So how do you get your child tested for autism? That's a good question. They're actually supposed to do a screening for autism in between 18 months and 24 months. Our insurance required a sedated hearing test for my son Ezra and a speech pathologist to do an assessment before he could actually get the assessment to see if he was autistic. And we're still living this right now because it wasn't that long ago when I was with my son and we were trying to convince doctors to see him. No doctors around us would even see someone who was younger than 2 years old. And yet we did beat the system and we got him in, and I'm going to tell you the full story at the end of this video. It's pretty crazy. So back to the question, how do I get my child tested for autism? First, we need to ask who can diagnose autism. Because most doctors that you see every day, like a pediatrician or a family doctor, they don't do the diagnosis, but they can refer you to a specialist. So these are the type of specialists that can diagnose your child. A developmental pediatrician who has had extra special training in behavior, a child psychologist who has also had additional education, a child psychiatrist, and a pediatric neurologist. Those are some of the professionals that can do an assessment for autism. Usually a specialist will actually require a referral. Sometimes they don't though. So it never hurts to just call up a provider or a clinic and ask them, hey, do you guys do an assessment for autism for children? And if they say yes, that's great. The questions to ask on that phone call is, do they take your insurance and do you need a referral? Now, a certain clinic might actually request a referral from a specific person or clinic. Our insurance required a sedated hearing test for my son Ezra and a speech pathologist to do an assessment before he could actually get the assessment to see if he was autistic. It was a long road. But if you end up going to your doctor first, like you're at a well checkup and you're with your child's pediatrician and you do a screening, and then they say, okay, I'd like to refer you to a specialist to get an assessment for autism, then that doctor will know who to refer you to. The trick is to get on the waiting list as fast as you can. This is a problem that almost everyone has. Waiting lists can be as long as 2 years. When you're at your well checkup with your pediatrician or your family doctor, they will usually do a screening. They're actually supposed to do a screening for autism in between 18 months and 24 months. It's super easy. It's just this paper that you fill out. They'll ask you questions. And what a screening is, it doesn't bring a diagnosis, but it just assesses at what risk level your child's at. And I hate those words, at risk. But that's what they use. They say, oh, your child's high risk for being autistic or low risk or medium or whatever. But your pediatrician or family doctor should be checking on these milestones anyway. And while you're on that waiting list, there's one thing I recommend. Contact your early intervention for your state. Some states call it Baby Watch, some states call it infant toddler program, but your state will have a specific early intervention for children who are 3 years and younger. All you have to do is call up the early intervention for your state and you shouldn't need a referral. And you say on the phone, hey, I have a child who's under 3 and I have some concerns. Here are my concerns. Will you please send someone over? An early intervention will assess, and if there are any serious delays, then you can get speech therapy, occupational therapy, physical therapy, and even more. What early intervention doesn't do is do an assessment for autism. You have to do that on your own with your doctor and with your insurance. But meanwhile, early intervention can be such a blessing. I was so grateful for early intervention to come and do physical therapy with my oldest son. He was born with a cleft lip, cleft palate, and club feet. And I was a young mom. I didn't really know what I was doing, but I was trying my best. And even with the casting for 3 months and learning how to walk really late, because of the physical therapy that we got through the early intervention program, my oldest son was able to walk at 12 months old, which was totally typical. And that was really exciting for me because then he didn't have to have those delays just because of his clubbed feet. Having early intervention to help me with my autistic son was a great blessing as well. Before we even got the diagnosis, I wasn't quite sure if he was autistic or not, we had an occupational therapist come that helped me so much. She kind of became my therapist, honestly, a little bit. She helped me see how I could help him. I had never really heard of someone being overstimulated visually, and turns out that that's a big part of Ezra's autism. And that occupational therapist that came when he was just a little over 1 year old taught me that and really helped me help my son. And we're still living this right now because my son, who's 2 years old, and yes, I have lots of sons. I have 4 sons and 1 daughter, so there's 5 kids. And I had them all on purpose. That's another story. I had early intervention just come yesterday to do another assessment for my 2-year-old. They do an assessment every 6 months where we live, and they played with him. They tried to get him to stack blocks. They did fine motor skills so that he would use his little pincer grasp, and he actually put the shoelace in the little, what's it called? He picked up the little bead and he put the shoelace in it. I was so proud. We have an occupational therapist and a speech therapist. They come once a month for my 5th child. And what's great is they teach me how to help him. But with early intervention, it's all up to you. The parent is really in control. At any time, I can just tell everyone to go away and never come back. I have that power. I'm not gonna do that because they're super helpful. Autism is such a broad spectrum. Ezra has a lot of the symptoms of autism that are kind of defined as classic, but a lot of kids don't. And that's what makes it tough for parents. Getting a diagnosis for your child can really bring you a lot of help. It can help you understand where your child's coming from. I have a good friend who has a daughter who's always had really high anxiety, and throughout all the years of elementary school, she's had a really difficult time. She'd run away from school and have really big meltdowns that would last hours. She went to the doctor again and again, and they never even said the word autism until she was 10 years old. Just called them up and was like, she's having the worst meltdown. I need to bring her to you right now so you can see what it's like when she's having this meltdown. And so she brought her in, and the doctor went, whoa, and saw firsthand how uncontrollable she was being. And because of that, then he said, why don't we get her tested? She might be autistic. It turns out that her daughter is autistic, and that has opened up huge doors. I remember talking to her husband, my friend's husband. It's the father of this 10-year-old, and he even said, he's like, my child has had strong anxiety that has been super difficult for her all throughout elementary school. And now she has a diagnosis that she's autistic. They roll out the red carpet. I remember him saying that. It was like the school treats her so differently. Now she can get all these different therapies because of the diagnosis. And so it can, for a lot of people, be a great blessing to know where you can get help, how you can get help, and how you can help your child. And when your child gets tested for autism, you can also mention the possibility of different diagnoses as well. The behavior might look similar to some people, but a professional will be able to say, oh, this child's autistic, or they have ADHD, or they have apraxia, or they have dyslexia, or there's lots of them. But all of those different diagnoses will be treated differently. So now I'll tell you the story about how I was able to get my child diagnosed for autism at a really young age, even before 2 years old, when 2 years old was the cutoff for everyone around us. Okay, this is what happened. I went to a conference where a professor at a nearby university was talking, and he knew a lot. He knows a lot about autism. He's always doing research and stuff. He had a great presentation. He told lots of stories and really opened my eyes to the possibility that my child might be autistic. And even though, doctors around wouldn't see him. And so after the conference, so I totally did this. It was like kind of embarrassing, but at the time I was like, I do not care if anyone judges me. And so this is what I did at the conference. He was done speaking and he was walking down like the podium area from the mic where he was speaking at. And I just got out of my seat and I ran. I bolted to where he was. And I was like, I have a child. He's got all the symptoms of classic autism. No one will see him until he's 2 years old. And he kind of bent down because he was still like on the podium sort of. And he's like, okay, this is what you got to do. And I was so excited. I was like, oh, there's like a way to get around it. He's like, yeah, this is what you got to do. And he gave you the name of a speech pathologist who works with a lady who diagnoses kids with autism. She does the assessment. She's like, this is what you need to do. Call the clinic and ask for the speech pathologist to do an assessment for speech with your son. And she's good. She will be able to tell if your child is autistic or not. And after her assessment, she will tell her friend, her coworker she works with in the same office, about your son, and she'll see him. And I was like, that's great. And that's what we did. I called up the clinic and I scheduled an appointment with the speech pathologist. I brought my son in. We had a fun little assessment, and I didn't even have to mention that I wanted him assessed for autism. I didn't even have to mention it because she brought it up. And she said, oh, have you ever considered getting him tested for autism? And I said, yeah, I have actually, but no one will see him because he's not 2 years old yet. He's really young. And she's like, oh. And she mentioned her coworker who will diagnose children with autism and do the assessment. And I was elated. I was like, that's great. That's awesome. And so we scheduled it. And we had to wait 3 months, which was annoying, but you know, it could be worse. And I remember walking in with Ezra, and she looked at him, looked at me, and she said, he is too young. You're not going to get a diagnosis. And I was like, okay, you know, but I was quiet. I knew better. And we walked out of there 2 hours later with a paper in my hand and an official diagnosis. And the rest is history. He was only 21 months old. I know now a lot of doctors will see children at younger ages, which I appreciate, because when your child gets diagnosed early, then I feel like you have a better chance of making less really big mistakes. Don't get discouraged. You are awesome, you are great, you are on the road to get your child answers. Whether or not they're autistic, it'll be really nice to know. The video on the left is a family travel vlog where you can meet my son Ezra and the rest of the gang. And the video on the right is where I talk about 5 things you need to know before your child's tested for autism. And remember, if your child is autistic, you're in good company.